A comparative analysis of acute hemorrhagic and ischemic infarctions on brain CT scans. Introduction. Brain CT scans are valuable diagnostic tools that provide crucial information about various neurological conditions. When evaluating brain CT scans, radiologists carefully differentiate between different types of infarctions, particularly acute hemorrhagic and ischemic infarctions. Understanding the distinctive features of these two conditions is essential for accurate diagnosis and timely intervention. Acute hemorrhagic infarction. Acute hemorrhagic infarction is characterized by the presence of bleeding within the brain tissue following a vascular event. This type of infarction typically occurs when a blood vessel ruptures, leading to the extravasation of blood into the surrounding brain parenchyma. On a brain CT scan, acute hemorrhagic infarctions exhibit several distinctive features. 1. Hyperdensity * hemorrhagic regions appear hyperdense on CT scans due to the presence of blood, which absorbs X-rays more effectively than surrounding brain tissue. The hyperdensity is particularly evident during the acute phase. 2. Irregular margins * the margins of hemorrhagic infarctions are often irregular and poorly defined. This irregularity is a consequence of the dynamic interaction between blood and brain tissue, leading to variable boundaries. 3. Mass effect * hemorrhagic infarctions may exert mass effect on adjacent structures, causing compression and displacement of surrounding brain tissue. This can result in midline shift, leading to neurological symptoms. 4. Perilesional edema * edema surrounding the hemorrhagic infarct is common and contributes to the clinical symptoms. This perilesional edema is often visible as hypodense areas on the CT scan. Ischemic infarction. Ischemic infarctions, on the other hand, occur when blood flow to a specific brain region is compromised, leading to tissue damage due to insufficient oxygen and nutrient supply. The appearance of ischemic infarctions on brain CT scans differs significantly from hemorrhagic infarctions. 1. Hypodensity * ischemic infarctions appear hypodense on CT scans, reflecting the lack of blood flow and decreased tissue density. The affected area is often seen as a well-defined, low attenuation region. 2. Clear margins * unlike hemorrhagic infarctions, ischemic infarctions typically have clear and well-defined margins. The lack of blood extravasation contributes to a more delineated boundary between infarcted and normal tissue. 3. No mass effect * ischemic infarctions usually do not exert mass effect on surrounding structures. The absence of bleeding reduces the likelihood of compression and displacement of adjacent brain tissue. 4. Vasogenic edema * ischemic infarctions may lead to vasogenic edema, which appears as hypodensity surrounding the infarcted area. This edema is a consequence of increased permeability of blood vessels. Conclusion. In conclusion, differentiating between acute hemorrhagic and ischemic infarctions on brain CT scans is crucial for accurate diagnosis and appropriate clinical management. Understanding the distinctive features, such as hyperdensity and irregular margins in hemorrhagic infarctions, and hypodensity with clear margins in ischemic infarctions, empowers healthcare professionals to make informed decisions about treatment strategies, including thrombolytic therapy, anticoagulation, or surgical interventions. Continued advancements in imaging technology and a nuanced approach to interpreting CT scans contribute to improved patient outcomes in cases of acute vascular events in the brain.